And so our first speaker is Associate Professor Lauren Ball. Lauren's an advanced accredited practicing dietitian. She's the group leader of the Healthy Primary Care Research Group at Griffith University. And she's also the global strategic lead for the NDEP Pro Global Centre for Nutrition and Health. Associate Professor Ball is a preeminent researcher in the fields of primary care, general practice, allied health, health promotion, wellbeing, and health policy. And all of these background disciplines rely on having good data, and good data comes from having a good research question. So with that as a lead-in, I'm going to now pass to Lauren to explain to us how to build a good research question. Lauren, over to you.
Very much, David. Can I start by acknowledging the traditional custodians of all the lands on which you're listening to this presentation at home? If you're like me in Brisbane, you are on the lands of the Yuggera and Turrbal people, and I'd like to just pay my respects to elders past, present and emerging. I'd also like to acknowledge the postdoc in our team, Dr. Caitlin Barnes, who's helped put together this presentation today. And if you're keen and on social media, I would absolutely love to connect with you. I've got my Twitter handle there. We're always trying to get more engaged on social media, so please don't hesitate to reach out. David, you mentioned that answering good questions involves having good data as well. And for clinicians, this is a really challenging area of research. Sometimes developing a good research question, in my experience, can take longer than the research project itself. Really, it's about turning a clinical question or an idea into something that can be acted upon in a research project. So I hope that this presentation is useful in taking those first steps into that research project. So for those of you who are new to research, you might be wondering, what exactly is a research question? Really, it's something that is essential to direct and center your research. It will help define your focus of research and draw a clear boundary on what you're interested in and keep out everything else. It can be particularly helpful to come back to your research question once you start your project. Really, anytime you might feel lost or overwhelmed or think, what am I here for again? Come back and remind yourself, what is the question that you're answering with this project? A research question should be open and not carry an assumption about what answer you'll find. So it's almost the opposite of a hypothesis, which is a directed statement about what you expect to happen. So now let's talk about what makes a research question a good research question. Firstly, as I mentioned, it should be complex. And by this, I mean that a good question should be open-ended, so not a yes-no type question. It should require a nuanced answer that relies on synthesis and analysis of ideas or concepts. So a good research question, therefore, is not simplistic. It doesn't require a single word answer or a brief answer. And here are some examples from our team at the bottom of the slide. The one on the left in green, this is a nuanced question with multiple components, and it will require a synthesis and analysis of ideas and data in order to answer this question. The one on the right is too simplistic. It doesn't add value or really add to the knowledge base by answering this. We could probably tell what the answer is without even doing a research project. Looking for my next slide. Here we go. Next, a good research question should be focused, defining a clear boundary for the research by referencing the specific area of exploration or of use. So it can be very helpful to define a population group, a phenomenon of interest, such as an intervention or an exposure, or even an outcome of interest. There are some guidelines that you can use, such as the PCOS or SPIDER way, to help run through what your question might be. So for an example, with PCOS, we look at the population, the intervention, the comparator, the outcome, and the setting. And I'll talk more about that in the coming slides. Next, a good research question should not be too broad or too narrow. Too broad of a question will open up the research to endless possibilities and may end up being unanswerable. Too narrow, and the research question might be too simplistic and not as valuable to answer. Again, here are some examples on the bottom of the slide. The red question on the right is too broad and might take a very, very long time to answer, by which time I've just seen that I've got the wrong slide on here. I'll come back to this. Let me just go back to my previous slide. Sorry about that. Here we go. So the example on the bottom of the screen, the red question on the right, it's too broad. What is the effect on health from climate change? It might take a very, very long time to answer, by which new impacts of climate change might already emerge. A better example is the one on the left-hand side of the screen, and which will only allow for a few climate change impacts to be discussed and focuses on the impact of climate on food systems in Australia over the last 20 years. So it's still big, it's still broad, but it is a little bit more manageable. Now I'll go on to this slide. A good research question should provide a clear value, and the meaning or the answer should be of interest or of benefit to other individuals or organisations or communities or governments. So to test if your research question is likely to provide value, ask yourself or ask other people, will this answer or question be useful? To whom and how? And when pitching your research question to others, prepare to be asked, so what? Why should I care about answering this question? So on the flip side, a good research question should not be boring. The answers should not be already well established. And if they are, perhaps try finding a different angle. If the result of asking yourself or other people the research question, if they say, why bother? This is a sign that the research question may not provide enough benefit or value to be done. So here are those examples again. The green question on the left has clear value in shaping practice within hospitals. We definitely know that we'd want to know which health conditions are most likely to mean that people end up in hospital for longer. The one on the right, we know the answer to this, and we know the answer is unlikely to change even with the passing of time. So we don't need to cover old ground. Next, a good research question should be answerable with the resources or the data that's available to you. You must be able to form an evidence-based answer using that data, and you need to be able to show that that data is supporting of your answer when you show other people. So without that evidence or data to support your answer, you might end up speculating or making unfounded claims or making logical leaps or other fallacies. Research questions that are too complex or relying on evidence that's unable to be sourced or shared can also fall into this category. Now, remember that evidence that's available to you might not be available in other contexts. For example, some evidence might be available to you under a particular security clearance. As a clinician, this can happen often, such as the privilege associated with seeing patient data. This can be a tricky spot to be in, but one that you need to be aware of when you are designing your research question. Now, I've got two really obvious examples for you this time. Oh, if my slide will work, sorry about that. So the one on the right, did COVID vaccine manufacturers devise a plan to make faulty batches of the vaccine? This is a really obvious example that we won't be able to conduct a traditional research project to answer such a question. We don't have the data, it's not publicly available. The one on the left might be quite similar, but it can be answered using publicly available data and therefore be reputable. Sorry, my clicker's not working well now. Okay, now I want to move on to talk about how to develop that research question. First, choose a topic that genuinely interests you. If you're going to be investing time and energy into conducting research, it should be something that you're interested in, that you can think about when you're in the shower or you're falling asleep at night. It can be good to point to topics or issues that have been highlighted as a priority by other organisations. For example, in the hospital setting, a hospital foundation, or an issue in your service or your job that other staff members or patients are experiencing. This will help make sure that your research project can provide value, and it might highlight some available support that you have so that you don't have to do this all alone. Next, do some preliminary reading or general topic reading in the area. to identify what's been done already and what gaps still exist. Try limiting your reading to the past 2 to 5 years to make sure you have the most up-to-date evidence. Sometimes you can look through the reference lists of what you find. You might find other related studies or other reviews that might be a little bit older than 5 years, but it really helps ground you into the existing knowledge base. Finally, and I would say most importantly, consider your audience. Who will find this research interesting or of benefit? Will people or communities or organisations influence or shape the question? It can be helpful to brainstorm a list of potential audiences or stakeholders that would be interested in the research. This can also be a strategic step to identify or align your research question with potential funders and really identify who else to engage with, how you might engage with them, and even when to engage with them in order to start discussions about your research. And a hint for this one, it is never too early to be talking to other stakeholders about your research ideas or your research projects. Next, start asking more specific questions when you consult the literature. This is very important to narrow down. If you know what the existing gap is, how will your project then fill that gap? So I'm coming back to that PCOS statement, which can be very helpful. Think about what your population is, what is the intervention of interest, what is the comparison group, what are the outcomes, and what kind of. After that, continue to refine and refine and refine again to ensure that your question meets the criteria of being complex, being focused, answerable, and interesting. Then it's important to take your question to other people. Talk to them about your question. This could be colleagues, stakeholders, even family and friends at the pub can be helpful. Getting feedback on your question from other people will help you again continue to refine until you're confident this is the right one for your research project. So finally, keep in mind that a good research question can look different in different contexts. Different research fields have preferences on what a good research question will look like. Some fields like questions that are very narrow and directional, others not so much. Think about the resources, time, and expected outputs you'd have of your research question, because this may shape your approach. Finally, a research question can evolve over time. There might be new evidence that emerges or unexpected findings as you start that might influence the value of your research and the direction that you take. Also considered unexpected disruptions such as COVID, natural disasters, anything else that can happen, even new technology that could change the landscape by which you're working in. It might create new questions as well as provide suggestions of how you might again need to change direction. So the important thing here, what I've discussed is this is just a guide. So be flexible and be ready to adapt these as appropriate to your specific area and context. So wrapping this all together, remember that a good research question will fill a gap in existing literature. It will be interesting to stakeholders. It will provide clear value for end users, such as clinicians, patients, policymakers, or other researchers, and it will be something that you are passionate about. Good luck developing your research questions, and please do reach out to talk further. We have a whole team here at Griffith very happy and willing to help. Thank you very much.
Lauren, thank you very much. That was perfectly delivered, and you've come in exactly on time. So that's the sign of a good presenter as well as a good researcher. So a couple of questions for you. You covered quite a lot of material there, and you made the distinction between complex versus simple research questions. And you were sort of erring towards having more open-ended and complex questions. Clearly, there will be times when a more simple hypothesis test will be required. Can you give us some guidance on when we should go for simple rather than complex?
Really, David, that's a great question. It really comes down to whether or not the project or the area is about exploring a problem or a question or narrowing down. So usually when there's an intervention or a trial. If, for the most basic example, might be a drug trial. Does this drug work? Really, that's when we want to have a very narrow question and we want to control all other variables. But we see more and more with research that that is not the real world anymore. That context is so important. So more and more, I'm finding that research questions are more open-ended, more nuanced, asking questions that do take into account, does this work, or in what situations might this work, whether it's drug or any other aspect of clinical practice, for whom and why and how. So there might be multiple parts at play, and there might even be several research questions that come into play within the same project to try and get that depth, that nuance in the complex world that we now live in.
Now, changing tack a little bit, the problem for many researchers is getting funding to make a big play for novelty, impact, and significance. So how much should we append to those characteristics as opposed to feasibility and, you know, open-endedness that you've been talking about as well? How much should we think of our research questions in terms of those big picture items?
So challenging, David. Probably the most challenging part of research, getting it funded, which means someone else needs to see value in your research. So when I spoke about thinking about stakeholders and thinking about what contribution is your project or question adding to others, if you can prove that your project will have significant benefit or help other stakeholder groups, whether that's other clinicians or patients or government in some way, I think that's the first step to making a case for getting funded. It might be that by doing that, you are doing something innovative, and innovation doesn't need to be something new and untested and unthought of, some grand plan that no one has ever thought about before, because it still needs to be backed up and by showing that you're confident that this is also going to work. So innovation can just mean applying a new method to a different setting, or testing out a new idea, or answering a question in a different way. It doesn't need to be a field leap into the next area of thinking. It can be an incremental addition to the literature. And as I've heard it put so many times before, you're adding one grain of sand to an entire beach of a field or a topic. So think about how are you etching that field forward one step at a time.
Very nice segue actually into our next speaker's topic, because really what you're talking about is where does this fit in the context of the literature. So Lauren, thank you for your presentation. Really pleased you could make it this afternoon. I know you've got a packed afternoon ahead, so we understand that you have to leave now. So thank you very much for taking part.